So this discussion topic is, why do people think rehab is only 30 days?
Insurance?
That's where my mind went to at first.
That would be my first answer. Insurance has dictated that, right?
Makes sense. I think they were the first to say we're limiting your benefit, and things have changed over time where they can't just come right out and say that. But we know, if someone's utilizing insurance, that utilization reviews are happening, once a week, sometimes more often, and they're dictating that. The approach needs to change to what does the patient need, and a lot of people have evolved into, you call up a treatment center and they're like, well, it's 30 days minimum. Instead of just saying, we're going to assess you first, we've got different stages of treatment, and as you progress, we'll give you feedback all along. Prognosis is much better when a person completes treatment. And if they go in thinking it's 30 days and they're not better at 30 days, and you have to tell them to stay and there's a huge fight and they leave, well, it's not going to be a good outcome.
I think something you mentioned earlier was extremely valuable too, was that not everyone requires to go inpatient for 30 days. So there can be those who require maybe 90 days of treatment and should be overseen by care for a year that have been through it. There are other people that maybe they just are having a little bump in the road and hasn't gone to that dark, deep level yet where they don't need to go to 30 days of treatment, but they're being told to, right? Because that's what we say.
Right. You have to follow the symptoms and you have to follow the individual's progress.
There's criteria for this exact reason. And you can do an assessment and find where they fall on the criteria of what level of care do they need, how long do you expect their care to be. To me, the whole 30 days is just so funny because there's zero evidence to support that 30 days can help you with these issues. Of course, it's beneficial, it's a start, but all of the evidence really talks more about 90 days and longer. So it's just so funny that that's the model that payers decide to pay for. That's the model that most treatment centers design their curriculums on. This 30-day model that there's no evidence to support.
It's really misleading. So you're talking about a medical diagnosis, which is addiction, or a behavioral diagnosis of mental health, and you're essentially comparing it to something where, if I broke my arm, I'm going to go to a doctor and they're going to tell me, okay, first you've got to cast it, and that's going to be 4 to 6 weeks, and then you do physical therapy for a few weeks if you need it, and you're done. And it's giving the patient, unfortunately, the expectation that all I've got to do is this amount of time, and I'm going to be better.
Yes.
And then they have a big wake-up call, not realizing that they have to actually change some different things that become more integrated into their lifelong journey than a short. Yeah,
they're creating false hope. And you've had a lifetime of trauma, a lifetime of mental health struggles, lifetime of misusing substances, but you're going to get better in 30 days. That's it.
Right.
I am going to contradict myself, though, just a little bit, that there is one good thing about the 30-day model, is that it's more palatable to somebody who's seeking help, and it does get them in the door sometimes, and then it's the hope that there's a clinical team that they're going to align with and recognize that this is going to be a longer process, and then they can extend their stay.
Yes.
So it's probably the only good thing about the 30-day model is that it doesn't seem like a huge chunk of your life. Because saying I'm going to go away for 3 months,
which
is what I did.
Trying to get that commitment on day one is hard, rather than eventually helping them to understand there's a continuum of care, and this is what's available.
I prefer to say whatever the clinical team recommends. I try not to say length of time, especially on the intervention front. We're going to go by clinical recommendations, and it could be this lame, it could be, and try to not give it a time frame, to be completely transparent, honest. I don't want someone coming back to me and saying, you told me it was going to be this, and I was there for 9 months. I don't want to ever be in that situation.
In treatment centers, you have someone that's there 30 days, and then they start seeing patients that are extended. And then the patients get this feeling that everybody there is being bonused. The new treatment wing is based on, if I tell you, you got to stay 60 or 90 days. And that's unfortunate because most centers are very ethical and are not doing anything like that. They're not, they're giving recommendations for further treatment based on what the person needs. But the providers are also up against that kind of ingredient of this is what it's going to be on day one, and it doesn't always work out that way.
I did a 30-day rehab myself, and I did a 90-day treatment stay that was followed up by 9 more months of outpatient care. And the second one, the latter, stuck. Yeah. The first one, I think I was just scratching the surface of my deeper rooted issues on day maybe 26, and then the treatment stopped. Yes. So I don't think you really can dive deep with just such a short period of time, but you know what? It is what it is, and it gets people in the door.
I will also say a lot of the times the easier work is in rehab. if you're in an inpatient facility at that higher level of care, it makes it pretty hard to keep using substances. It makes it pretty hard to have the same behavioral problems that have affected you in the real mainstream environment. The real work is afterwards, and understanding that your treatment does continue. It might not be at that level of care, but just like you said, you went on to an extended program for a while afterwards,
Right.
and that's where the mainstream work starts to happen and the integration back to life starts to happen.